earliest convenience. For assistance, please contact Managing Committee. We now welcome Dr.G.Chaitanya sir, Professor and HOD, Department of Community Medicine, Vice Principal at Geetham University for the next topic, which is Developing Reflection Writing Skills.
Professor Community Medicine at Carturi Medical College. There is a small change in my workplace very recently. Thank you for the introduction. The topic that is allotted to me is reflection writing, how to develop reflection writing skills. The outline, I just try to make it to make understand what is reflection writing, why is this important, and how can we promote some strategies for implementing reflection writing. Before I start my presentation, I just have a small video clip.
You can't what?
I can't swim.
How old are you?
6. Help him! He can't swim!
Have you learned? Everybody should swim. Just reach out in front of you and grab a handful of water. Pull it back towards you. Not too bad. That's the way I learned.
I did it, Verona! I did it!
Good.
Well, how did he get back?
Swim.
Well, he must drown.
Well, then you go get
But
it.
I can't swim either.
Run.
Can I have any quick thoughts on what the video is trying to say? Yes, sir.
Immersive learning.
Immersive learning. Sir,
Wanted to study the scenario and situation of a final student passing exam and going to internship to do things.
okay.
Self-directed to the business.
Self-directed learning, okay. So anyway, yeah, thank you for your responses. I just proceed to the next slide with a small disclaimer. If any of us in the process of implementing the CBME curriculum have felt like the kid, it is purely coincidental. Let us hope we will not use that kind of a learning experiences, and let us see or let us understand how we can better or how we can give some better practices with context to the reflection writing. So, what is reflection writing? We all by this time have a fair idea of what is reflection. So, it is an analytical practice where the person who is writing, he tries to describe a real scenario or an imaginary scenario, which whatever we are trying to provide his experience, or he may describe an event which is associated with his learning. It can be an interaction. It can be an interaction with the patient, interaction with the attender of the patient, either for the consent or for promoting for blood donation, etc. It can be some thoughts, some learning experiences like what we try to understand when we have seen some video. It can be from the memory, or it can be some feeling or emotion. So any of this can be pertained to the reflection writing as a learning activity. What are various types of reflection writing that can be commonly adopted with regard to the context of medical education? It can be a journal, it can be a logbook, it can be peer review, it can be a learning diary, or it can be a small reflective notes. Sometimes reflection can be used as a self-assessment strategy to think over and improve ourselves. So these are commonly, or these are some of the reflection writing strategies which we can consider adopting into the undergraduate or postgraduate curriculum as a part of promoting reflection writing. So what is the whole purpose of understanding this reflection writing? For the holistic medical growth, reflection can help in learning, it can help in improving doctor-patient relationship, and it can also improve or encourage for a better professional identity. All these things will help towards bringing out a holistic medical growth for the career as well as for the individual, and also for the healthcare professional, whoever we are trying to bring out as a product of the educational system. So if we go into proper definitions of what is reflective writing, or what is reflective practice. It will help in stepping back and review our actions. It can recognize how thoughts, feelings and emotions are done. It can help us to understand how it affects decision making, clinical reasoning, and how it can be useful for improving professionalism. And the most common form of reflective practice is reflective writing. That's why we are trying to understand how we can, or what are the different ideologies where we can promote reflective writing. Why is this important? So why should we understand with regard to reflective writing, or what is the context why we are dealing with this kind of a topic? So we all know the Indian medical graduate has already identified roles. Since yesterday and since long, many of the roles have been discussed. In addition to these roles which he is performing, leader, clinician, communicator, lifelong learner, professional, in 2023 there are 2 more roles which have been envisioned, and these roles are: he should be a critical thinker, and he should also be a researcher who conducts investigations and some kind of a research studies. And it is always said reflection writing is cornerstone for developing critical thinking and also for improving professional behavior, as well as for him to become a good researcher. This reflection writing comes in in this core activity, where to enhance his skills, in addition to the above mentioned 5 skills, it is the cornerstone for improving this critical thinking as well as research capabilities of the Indian medical graduate. So it is always felt that being reflective is an essential for good performance in each of these roles, and reflection improves and fosters critical thinking, where it will help in improving the analytical ability, inference, and also evaluating different kinds of scenarios. In this context, with this what is reflection writing and why this is important, we have to understand reflection plays an important role in the new Indian medical curriculum. So however, there are no explicit guidelines for training and execution. So it is not my opinion, this is from an article which we will be quoting. And hence the responsibility of implementing reflection or reflective writing lies with the institutes and as well as the faculty to incorporate teaching of reflection writing and assessment of reflection writing into the curriculum wherever it is feasible, to identify and promote this practice among undergraduate learning. Then the most common thing is this is not possible, or why this is not possible. There are some barriers which are perceived. So many of the times we feel it is time consuming, but the actual reasons that we can understand is lack of skill. The student is not knowing how to write a reflection, neither the faculty also might not be in a position to make them understand how to write reflection in a proper manner or how to expect. Because many of us, we have to accept we are not trained, because we are like that child who has been learned how to swim. If we have learned the art of swimming, it is well and good, but most of us, I feel that we are in that way of learning where we evolve with practice, and there may be the organizational culture which may not have a promotional criteria, or it is mandatory now that we have to find out ways where we can incorporate it. The teaching learning environment, motivation, so it is our motivation as well as the student motivation, and all these things are not real barriers ourselves. So the mindset or the change, whatever has to happen in ourselves to understand how to incorporate reflection writing into the curriculum. All these barriers are can be addressed. That is the important point why I tried to present this. These are not real barriers, these are all perceived barriers. So it is possible. So then how can we delve into, or how can we understand what are the strategies that we can incorporate to encourage reflection writing? I tried to break it into some logical steps. So these can happen at the individual department levels or individual faculty level. So the first and foremost one is we have to decide on the topic or whatever competency where we are supposed to give reflection. We identify the setting. So in what kind of a setting we are supposed to or we are going to give it. provide whatever experience that we have planned to be reflected upon. It can be a case taking, it can be an exposure to a surgery or his observation of a surgery, it can be an encounter between a doctor and a patient in an outpatient department. So we have to decide upon what is the experience we are giving for them to reflect upon. Encourage at all stages, whatever stages it is possible, we try to encourage him to reflect upon. Some are verbal reflections, some are written reflections, and there can be a digital reflection also which we can do. Wherever possible we can use digital, as it has been already mentioned yesterday that the new generation, they are more tech savvy, or it can be easily incorporated, or any other innovative options with whatever we can explore for reflective writing, and develop a relevant assessment framework and embed within the existing teaching learning approaches. Why we have to embed within the existing teaching learning approaches? Because one of the barrier what we saw is time. There is no time. So don't try to do it as a separate activity. Try to incorporate into the regular teaching learning activity at the department level wherever feasible. So it is our responsibility to identify where are the points where we can incorporate reflection. At a small amount, it is not to the level what we are thinking, at least to the level what the student is able to interpret and write the reflection. So what are the different scopes of reflection writing in the CBME curriculum? What are all the settings that are already being given? One of the important setting is early clinical exposure. The student can reflect upon his early clinical exposure in the concerned departments, whatever exposure it is given. As a part of the ADCOM competencies, there is a scope for reflection writing. In the student doctor method of training, we can utilize an opportunity for reflection writing. These are all the scopes that are mentioned in the CBME curriculum, which I am trying to highlight upon. And as a part of self-directed learning, I think some of the audience has already told it's a reflection writing is a type of self-directed learning. It can be used as in the electives. After the completion of the electives, they can reflect upon what they have learned and how differently they have learned. It can be done in the logbooks as a reflective writing, though ideally writing reflection in the logbook may not be there, but something is better than to make a start. We can consider writing reflection writing in the logbook also. Usually what happens is in the logbook, when we are trying to incorporate reflection, one student writes reflection and everybody copies the same reflection. It is not reflecting on his experience, but it's a copy of somebody's reflection. The whole purpose gets defeated. So to overcome that, and we all know because that is happening, we can always have an idea how we can overcome it. And it can be a portfolio, while with regard to the postgraduate learning, we can add as a part of experiential learning. I think one of the audience have pointed out that the video shows towards experiential learning. So, and also to the subject, some of the competencies in the particular subject, some competencies if we can identify, that is our role, that is where our role is, identify the competencies where you can incorporate reflection writing and then try upon what are the strategies which we can use for assessing these competencies through reflection writing. The theory of reflection, we know there are many models. I think whatever our role is to identify what model is going to suit the setting or competency which we have seen. If we have chosen elective, what model suits? If we have chosen any other thing, what model suits? The most common model that is being used in, as far as my experience or many of other department logbooks which we have seen, is the Roffel's framework for reflective practice, where the student will try to answer what happened, so what, and what next in a very simpler way. These are called prompts. So we give the prompt for the student so that he will try to reflect upon the prompt whatever we have given to understand that question and try to give the experience or the reflection what he is going to do. So what happened? There is a patient, a doctor-patient encounter has happened. So what? So in this interaction, I have observed the following things. So what next? Whenever I am trying to interact with a patient, this is what I am going to follow, or I have learned that this is what I should not do, but because it is going to cause. That's it. That's a kind of a reflection which they can give. All other things are more or less similar. They just use the different terminologies, whatever we are using. Another model which we can use is describe the deal model, describe, evaluate, and how it will help in articulating his learning experience. So these are some of the models. Our role once again here is to identify what model is suitable for the setting that we are going to choose. So what are the different settings where we can create opportunities for students to reflect upon? So this is our role. Once again, we can try to provide a reflection in a classroom as a part of a teaching, or it can be in a clinical setting, or it can be as a part of a formative feedback. We can encourage reflection, or we can also encourage reflection when the student will try to record or try to reflect upon his own individual experiences that happen in the particular department in his part of learning. So how can we reflect in these settings? So if it is a classroom setting, we can reflect upon by asking some reflective questions either before or after our session, and these reflective questions can be based upon 1 minute paper, or it can be think, pair, share technique, or whatever prompts we can use. Prompts are nothing but some questions which encourage student to reflect upon what is being taught in that particular session. So what was the most difficult point that he has found to understand in that particular aspect, or what was the one thing that he could remember out of the session that has been conducted. So these are some things where they try to reflect the key points or the difficult points. In the clinics also, the setting we can use either by reflective small group discussions. We can encourage after a case taking what happened, and the discussion come out regarding how can it be done, or what was the mistake that happened, or how can it be avoided. These kind of prompts can be used, and even it can be either by using digital storytelling, by using some ready-made case scenarios that are present, or it can be by flashcards. Again, our role is to create some flashcards where some clinical encounters at the early stages of the student training, they can be mimicked using a flashcard, and if they reflect upon correctly, they go to the next flashcard, and some more information given they can reflect upon. So our role lies in identifying and creation of this kind of an educational material. It can also be used as a part of formative assessment after a case presentation. We ask to reflect on their performance, like what was good or what went well or what did not go well. More or less these models these are based upon the actual scenarios, what was good, what was bad, and how can it be improved, and then it will be followed by our debriefing and also our feedback upon how they can improve upon. So this reflection comes in between the performance and our feedback. And individual experiences are some unique to the departments where we can reflect upon the student to write a reflection of his own subject. In each subject, at least 3 or 4 reflections per subject per year, where he will unique experiences whatever he has undergone. So to develop simple steps to follow these things, we can encourage them to develop a reflective writing skill. One strategy can be a reflective writing journal. Another one can be to develop a set of questions which we can do it. In a reflective writing journal, once again we guide him regarding what are the things that they should be able to write. This event, so describe the event, what did I learn, what went well, what could I have done better, and what are the long-term implications. So this is more or less similar to the case scenarios, whatever the formative assessment or long case after presentation of a long case. I think this kind of a journal can be maintained where they can write at the end of the law case taking, they can reflect upon what happened, what did they learn, what went well, or what could have been done better. Just to add one more point, so we should while that in the point of training, we can write them what to write, what should the student write. So begin with the description of his experience, explore what the feelings, what are the thoughts he felt at that time. In the beginning, when I want to approach the patient, I felt a bit, I'm skeptical whether he will answer my questions or not. But slowly I introduced myself, then I started asking, I established comfort. Then to my surprise, then he has answered many questions. I thought this is a sensitive question. He didn't answer it first. Then like that we can encounter, provide an analysis of what was good and bad, and some conclusions can be drawn, and they can also make some learning point that how he can improve upon this kind of a experience. The second step is to develop a set of questions before, during and after a learning experience. So some kind of questions that we can experience is what do you think might happen before an experience. So this kind of an experience, if we take into consideration, this can be set as he is given an opportunity to observe a surgery or to assist in a surgery. So what is expected before that experience? What do you think might happen? and during that experience he can write what is happening now, is it working out as he has anticipated, and after an experience they will write what are his insights immediately after, and after some gap is there what happened, and in retrospect what did he go, whether the challenges have happened, whether they have been anticipated, and whether they have been dealt with it, and in future how he can improve his scenario. So this can be a continuous process where we can encourage reflection. So now that we try to understand these are the things, then we come to the most important aspect, the same chart which we tried to show. We are here at the arrow, how to develop an assessment. So anything, we all by this time we understand anything that is not assessed is not given much importance. But here, so our role once again lies in identifying a relevant assessment framework, how to assess. But one word of caution is, please, it is mentioned is, don't try to assess every reflection. So not everything needs to be assessed. What we select pertinently where we can use it, and so how to develop a relevant assessment framework. So this assessment of framework, there are some commonly used methods, there are some criteria. Here I just tried to mention the Moon's criteria, where there will be a grading of the reflection. The grade F, A, B, C, D, E, F. The grade F is a very poor description. The event is not described properly, and it increases in order of reflection, where they describe the event but the details are repeated again and again without any interpretation of what happened in the event. And then in the next level the event is described, but it is not explained why it is important. And in the next level, how it affects the attitudes, feelings and beliefs are there. Another one is it involves judgment, that he will be able to reflect upon what went well, what went lesser and why did not go. And ideally, how does this event have changed or how it challenged his previous experiences is grade A. So ideally we expect the reflections to be in A and B. Most of them will be at the grade F in the last category, but our role is to see that they are stepping up the ladder across the different phases with regard to the writing of the reflection. So another very commonly used reflection thing is by rubric or reflect rubric, which was proposed by Wald. There are 7 parameters which we can use, and the highest scoring that is proposed here is a 4 score. So presence in the reflection, if the individual is fully engaged, authentic and openness is there in the reflection, the highest score that can be given is 4. If there is any description of a dilemma or conflict is there, it can clear identification and complex clinical or personal experiences are there, we can give a maximum score of 4. If he attends to the emotions, if there is analysis and meaning making in the reflection, we can give the highest score, which is examining and interpreting why between the experience. Why did it happen like that and what are the important parameters. Then the experience have been evaluated, what went well, poorly, and what is his contribution, how he can integrate with the learning, and how he can use it for learning and action. So these are 7 commonly mentioned parameters where we can use upon, and we can use a Likert scale 0, 1, 2, 3, 4. And the next slide I try to present a mixture of these things. So based upon this, the reflection writing assessment rubric may be mentioned as excellent, good, satisfactory and needs improvement. So this is where once again we know there will be definitely under need improvement category. We have to bring them to satisfactory, good or excellent, and we can apply the criteria. These criteria we can frame based upon whatever scenario or whatever competency we have identified. What are more or less similar to the Wald's criteria, what we have seen in the last slide. Describing the experience, the depth of reflection, application to learning, and integration with theory, clarity, emotional insight and empathy, and professionalism. So these using this kind of a chart, we can see that there are maximum 28 is the score, 7 parameters, 28 score can be given. So this is interpreted like this. If there is a range of 24 to 28, it can be interpreted as excellent reflection, 18 to 23 good reflection, 12 to 17 developing stage of reflection, and less than 12 there is a limited reflection. So this will help us in guiding them towards a higher level of reflection, and this is where we can identify what criteria we can choose, and similar things we can evolve at the level of our department levels or institution levels, so that we can promote the reflection. So now knowing all these things, then what is the last or next step? To summarize in a way, we need to understand that there is a framework for reflection incorporation into the day-to-day setting. It should be contextualized. It's called 5C approach or 5C framework. Contemplate, contextualize, that means it is tailored to the student's reflection level. As we have seen now, the learning always has become student-centered, not the teacher-centered. So don't try to expect the student to reflect to our level in the first experience or in the first clinical year anyway. So tailor it to the student's reflection level. Even if it is the same experience, let us observe that reflection changes from grade 1 to grade 4 over a period of time when his training is happening, and not all of a sudden. It should be connected, link to the theory, link the theory to his practical exposure, coach him, guide him towards during the reflection process, challenge him, question his whatever, wherever, challenge his reflections, test his knowledge, improve upon or provoke his thinking, and it should be continuous. It should be woven into the curriculum. It is not a separate standalone exercise. So these are some of the references which I tried to utilize or which helped me in making this preparation. So to summarize, I just want to quote, every skill you acquire doubles your odds of success. It's a quote, unquote, by Scott Adams. So reflection as a skill will double the chances of success of the Indian medical graduate to perform the roles that are mentioned. And using this platform, the AP Medjucon 2025 with a theme Kausala Vardhanam, where aiming excellence towards skills, let us all thank the organizers for the theme and for the opportunity, and I convey my regards for the chance. Thank you very much. Thank you very much.